Hello and welcome back to the Common Mistakes series, and it's time to cover the legs. Now I've decided to separate this video into two distinct episodes because when it comes to leg training, it's a little bit more complex. There's multiple joints and muscles working together, and depending on the fact of whether you have overactive muscles which need to be stretched or weak muscles, you need to address those imbalances before you start doing something as complex as a barbell squat, loading a bar on your back. If you just jump right into an exercise like the barbell squat without addressing these imbalances, you're really running the risk of injuring yourself and also not performing the exercise effectively and getting the most out of it. So today in episode 1, I'm going to focus on solely the squat. I'm going to show you an assessment that you can do on yourself, or if you have a fitness professional watching you. Either way, you can film yourself and correct these imbalances. If you see that you have a lot of these imbalances when you squat, what I'd recommend is that you follow the exercises, the supplemental exercises I'm going to show you to either strengthen the weak muscles or stretch the overactive muscles. I would combine that with machine exercises in the beginning, so you learn to strengthen the leg musculature in a safe and controlled way. Now the machine section I'm going to be covering in episode 2. Today's going to just be revolving around the squats. So follow me, here we go. Okay, so probably the most common mistake I see when I'm assessing or watching a squat are going to be that the knees cave in. So a lot of times when someone's squatting, on the way up especially, there's a caving in of the knees. And that pattern over time is a big recipe for disaster, a big recipe for injuring your knees. So what it means when you have those knees caving in are a couple of things. One, you have overactive adductor muscles and overactive vastus lateralis muscles. The outer part of your quad and your adductors are overactive, so they need to be stretched. Those two muscles are tight, and what happens is they're forcing the knees in. So it's creating an improper movement pattern and really an unsafe pattern over time, okay? So once again, the muscles that are going to be overactive and must be stretched are going to be the adductor muscles here of the inner thigh and the vastus lateralis muscles of the outer quadriceps, okay? So the muscles that are weak and need to be strengthened in this in order to be able to push your knees out and have a proper squat, because ideally the knees are going to be directly aligned with the toes. Even on the way out, we want to be able to push our knees out and keep them in line with the toes as we're performing the squat, right? So what this means when I see the knees caving in, that means the glutes, the glute medius especially, is weak, and the vastus medialis oblique, this muscle here in the center, and the inner thigh, is weak as well. So I'm going to show you an exercise that you can do to strengthen the muscles of the glute medius and also the vastus medialis oblique. Okay, so one of the best ways to address this compensation of the knees moving in and learning to strengthen the muscles of the glutes and vastus medialis in order to push the knees out and keep them strong during the squat. One of the best ways to do that is by performing a band or a tube walk. So here's how you're going to do this. You're going to use a band or some sort of elastic tubing, and you're going to put that around your ankles, okay? So you're just going to adjust it around the ankles. You're going to take your feet to about shoulder width distance apart, and you can come down into a little bit of a squat. So you're going to get a slight bend in your legs, and then what you're going to do is you're going to do lateral walks. You're going to try to keep your feet pointed straight ahead, and you're going to do walks side to side, okay? You can go in short distances back and forth, or you can go the length of the gym. It's really up to you. What you want to try to do though is hold a bit of a squat, keep the toes pointed forward, keep the head and chest up, and take small steps to the side, okay? Small steps to the side here, okay? So over time, what this is going to do, it's going to really strengthen the muscles of the glute medius and the vastus medialis. It's going to prevent the knees from caving in. This is what you're teaching these muscles to do as you're strengthening them. So this is one tip that's going to really help you once you progress onto the squat. So we just addressed a few exercises to do in order to address the muscles that are weak. And now we're going to look at stretching and relaxing the overactive muscles, which are causing the knees to cave in towards each other when you're squatting. So this foam roller here is going to become your best friend. when it comes to the squat and the knees caving in, we need to relax the adductor muscles of the inner thigh and also the IT band and vastus lateralis, the outer leg, okay? So here's how we're gonna do this. We're gonna place the foam roller on the floor and we're gonna come on top of the foam roller. So we're gonna have our knee up like this and we're gonna rest our inner thigh on this foam roller. So you can have your elbows on the floor or the hands. And what we're gonna do is we're gonna start at the groin and we're gonna start to slowly shift out. Once you find an area that there's some tension or discomfort, I want you to hold it for about 20 to 30 seconds. And you'll find that there's a point where it releases and relaxes and starts feeling a lot better. Okay, so we're gonna roll back on the leg, roll back and forth about 2 to 3 times. Once you find that point where there's tension, hold it and come back in, okay? All the way into about where the knee starts, and then we're gonna roll back into the groin. Okay? So now, we're gonna do that on both sides, obviously. So now we're gonna relax and release the outer leg, the IT band and the vastus lateralis muscle, okay? So we're gonna do the opposite. We're gonna lay on our side. We can either be on the elbows or up on our hands, it's up to you. If you come down to your elbows, you're gonna exert a little bit more force onto the side of your leg. So I would recommend as a beginner, if you're just starting this, start up on your hands and it'll be more gentle. So we're gonna start all the way up at the hip. We're gonna start rolling down the leg. Once again, once you feel that there's an area that there's some tension, hold it 20 to 30 seconds until it releases and move all the way down towards the knee. Okay? So slowly find an area where there's tension, hold it 20 to 30 seconds, and go back up and down 2 to 3 times. We're gonna do that on both sides. So common mistake number 2 that we're gonna be looking at when it comes to the squat is an excessive lean forward. So I'm gonna show you from the side here. Now I see a lot of people, whether they have a bar in their back or they have dumbbells, what happens is they start squatting and they lean forward excessively. So it looks like this. There's not a lot of bend in the legs, but the torso is coming forward a lot, excessively. And that can be dangerous, especially if you have a bar in your back. You can put a lot of undue strain on your back, on your spinal erectors, and that can lead to an injury. Okay, so this is not how we want to be performing the squat. Okay, so there's a couple of things to look at here. Now when it comes to the muscles that are weak and need to be strengthened, we're going to be looking at the spinal erector muscles and the glutes. Okay, these are muscles that need to be strengthened. Now what happens is the overactive muscles, the ones that need to be stretched, in this case are going to be your calf muscles. It's going to be the calf muscles, it's going to be the hip muscles, the hip flexor muscles, and it's going to be the abdominals. These are all overactive muscles which are going to cause an excessive lean forward. Okay, so first we're going to look at the strengthening exercises and then the releasing exercises for one of my favorite exercises that I use when I'm teaching people to squat, especially if they have an excessive lean forward, are going to be ball squats. So what we're going to do is we're going to place the ball on a wall here. And the ball's gonna go on your lower back here, on the lumbar spine, okay? So this is great because it teaches you how to keep your torso upright, thus strengthening the spinal erectors, and it also facilitates depth. So typically when people do this variation, they're able to get a lot deeper into the squat and learn their depth and work the glutes as well, strengthen the glutes, because the lower you go, the more of the glute muscles you're gonna recruit, okay? So we'll have the ball on the lower back, feet about shoulder width distance apart, and we're just going to use the ball as a guide to gain as much depth as possible in our squat. Okay, so we're going to keep the torso as upright as possible. We're going to get as low as we can. Once we reach our maximum depth, we're going to pause, push into the heels, and ascend. Okay? So this is really a phenomenal exercise to strengthen the spinal erectors and the glutes. And you can progress this. Once this gets easy, you can grab some dumbbells, hold them at your side, and perform a set of squats like this. Okay, once you get really good at this exercise, you're at the point where you can almost put a bar on your back and start squatting just with the Olympic bar. The stretch we're going to do in order to release the hip flexors is going to be the kneeling hip flexor stretch. Okay, So I will demonstrate. We're gonna have one knee on the floor, one leg out in front, and we'll just start at this 90-degree angle right here. For some people, just being in this position, they're already gonna feel a stretch in the hip flexors, okay? If this is easy for you to intensify the stretch, all we have to do is start leaning forward a little bit, okay? And then you're really gonna dig in there, and we wanna hold that for 15, 20 seconds, okay? And then we'll slowly release, okay? So for those of you who have very tight hip flexors, you can start at this 90-degree bend, and that might be enough to start. But you can challenge your flexibility slowly over time by leaning forward a bit more. And then if that's even easy for you, you can even bring your hands to the floor and lean into that a little bit more, okay? And just hold these stretches for 15, 20 seconds, and we're gonna obviously do that on both sides. So now we're gonna address the calf muscles, which are overactive and tight, which is causing you to lean forward in the squat. So I'm gonna grab the foam roller. Here it is. And we're gonna do another foam rolling technique for the calves, okay? So this one's pretty easy. What we're gonna do is we're gonna place our calf right above the foam roller, okay? And we're just gonna roll our calves. So you're gonna push your butt off the floor, so you're gonna kind of be up on your hands. It'll be a bit of a workout for your triceps and your arms. And we're gonna start all, behind the knee, and we're gonna slowly start rolling down the calf. Okay, until you find a point that's tense, and just like the other ones, we're gonna hold it for 20 to 30 seconds until you feel a little bit of a release. And then come all the way down in the direction of your ankle. And you're gonna go back and forth about 2 to 3 times, holding at the points where you feel tension to release it, okay? And obviously we're gonna do that on both sides also. The most common mistake I see when assessing the squat is gonna be an excessive arch of the lower back. So I'll show you from a side angle here. So when people are squatting, you see this huge arch to the lower back when they're coming down and on the way up. Right? An excessive arch of the lower back. Now this is going to put undue strain on your lumbar spine, and you could end up with lower back problems down the line if you continue to perform the squat in this manner. So when I see the squat performed in this way, it signals a couple of things to me. In terms of the muscles which are overactive and need to be relaxed and stretched, we're going to be looking at the hip flexor complex and also the lat muscles, the latissimus dorsi. These muscles need to be stretched and relaxed. And then when it comes to the musculature that needs to be strengthened, we're going to be looking at the glutes once again and the hamstrings. So I'm going to show you a couple of strengthening exercises for those muscles, and then some relaxing exercises for the muscles which are tight and need to be relaxed. Okay, so a fantastic strengthening exercise that we can use to strengthen the hamstrings, in this case, is an inverted ball curl here with the medicine ball. So I'll demonstrate. So we're gonna lie down on the floor. And step one is gonna be to lift our hips up off the ground. So we wanna maintain that position with our hips lifted the entire set here. So what we're gonna do is we're gonna pull the ball in towards the butt, pause at the top of the movement, and lengthen. If you can give me a little bit more lift of the hips as you pull it in, you're gonna work the hamstrings even more, okay? So this is a fantastic exercise to strengthen and isolate your hamstrings, and you'll also get some indirect work on your abs here, which is great. Okay, so that's the first exercise to strengthen the hamstrings. And then we have to look at the glutes also, okay? So in this case, I would just opt for a glute thrust. You can come off of the, you can do this off of the bench or off of the medicine ball as well. So we're gonna want the lower back hanging off the ball just a bit. We wanna push into our heels and force the knees out at the top of the movement. So we're gonna pause, clench and squeeze your glutes, and then lower the hips almost to the floor, okay? Pausing at the top of the movement, forcing the knees open, and lowering slowly. Okay, if you wanted to intensify this exercise and make the glutes work a little harder, you can place a band just over your knees and do it that way as well. Time to release the tight muscles. So again, when there's an excessive arch in your lower back, the hip flexors need to be released and stretched. So once again, I would just opt with the hip flexor stretch, which I showed you in the last section, okay? So we can start here and lean forward if you need a little bit more stretch, if you can handle it, okay? So that's the hip flexor stretch. You're gonna do that again. If you notice there's an excessive arch of your lower back, we're gonna do the hip flexor stretch once again, okay? And then the other muscle that needs to be stretched is the lat muscle, the latissimus dorsi muscle. So one of the best ways to stretch this is with a ball, a lat ball stretch here. So we're gonna be on all fours. We're gonna have one hand on the ground and we're gonna have our elbow and forearm up on a ball here. So what you're gonna do is you're gonna extend your arm, you're gonna lean forward so your chest is about parallel to the floor. You're gonna hold that stretch. You should feel an amazing stretch through your back here, through your lat muscles. So you're gonna pull it in and stretch. Pull it in and stretch. And you can really just lean forward, lean your chest and torso into this exercise. Lean your weight onto the ball a little bit. And this is a fantastic exercise to stretch out the lats and relax them. That's going to conclude today's episode in the Most Common Mistakes series, Squat Edition. In the next video, I'm going to be covering some other traditional leg exercises people use to train their legs and highlight the most common mistakes I see and how to correct them. So I hope from today's video you're able to take these exercises that I've shown you and supplement them into your workout so you can see some greater progression in your squats. Take care.